Good evening, students. This is Dr. Hemanth, faculty for medical oncology at Dr. Tutorials. Today, we are here to interview our AIMS merit list rank number one for the INISS 2023 DM Medical Oncology, and that is Dr. Shubham Sahni. Hi, Shubham.
Hello, sir. Good evening.
How does it feel to be on the top?
Honestly, it feels great, and I feel relieved actually. I mean, there have been a series of entrances right from MBBS till DM, and probably this was the last perhaps, and
Last.
ending it in a good way feels great.
Yeah, absolutely right. So it is, yes, definitely feels good, but that term of actually feeling relieved is there. And even I felt probably my DM entrance was the last exam that probably I was going to write. Exit was there, but at least the entrance part, that was the last thing that I was going to write. So that is good. So Shubham, can you just tell our viewers your background, where basically you're from, and where was your undergraduation, post graduation, and now what we're doing?
Yeah, so I've done my undergraduation from the All India Institute of Medical Sciences, Rishikesh. Post that, I've done my MD medicine from AIMS New Delhi, and I've completed my MD in December of 22. Post that, I've been working in the Department of Medical Oncology. I mean, it's been almost 5 months, and this and then I scored rank one in this exam.
Fantastic. Vijay?
So let us know, how did you come to know about our doc tutorials, and how did it help you about?
So actually, I mean, in MD also, I'm a person who definitely I like reading books, but I'm a person who has a visual memory. So, I like watching videos and I'm watching them at 2x or 3x and then, rapidly replaying them. So while I was, I had decided that I have to do oncology. So I was trying to search for sources wherein I can, have a ready reckoner source for oncology. So that's when my friends at a different institute, they recommended me that, there's this app and it has a question bank and all. And I feel there are very few sources for oncology right now, and Dr. Drills was one of them. So that's how I subscribed to this app, and I started watching the videos, and watching them at 2x and 3x, and so that's how I discovered that this
It's
app was there.
basically like a refreshing revision for you, what you have read through in the
Yes, sir.
books,
Yes,
right?
sir. Yes, sir. I like reading from the book as well. But then at the end of the day, you have to know the knowledge that is going to be asked in the exam, and that too you have to retain that also. So suppose I've studied say a topic say anal cancer from some area, but I want to refresh that knowledge. I want to know which are the key to focus areas in that topic. It's not a bad idea to go through a video, maybe go through it again, and at the time of revision when you don't have time, you can just watch those videos at 2x and rapidly revise. So that's how I feel. It benefited me.
Basically, it consolidates what you have been reading through in your books.
Yes, sir. Yes, sir. And I have this habit that whenever I read a topic, not just doc tutorials, I go to YouTube, I go to any random channel and say I have to revise colorectal cancer, I have to read colorectal cancer. I'll go to YouTube, I'll watch a video, I'll watch 3 videos on that topic, so that when I've gone through so many areas in my free time, say I know which are the topics that are hot topics or which are the topics to focus in that particular domain. So, that really boosts my visual memory, and I think that helps me retain.
Yeah, absolutely
Basically,
true.
all
I
these
think, yeah, absolutely true. I think one of the most important factors that you told is visual memory. So if I have to give my example, what helped me. So one probably was you if you are watching YouTube videos, there's somebody called Armando Hasrunga who actually kind of cartoons most of the stuff, and that was where I kind of started looking during my MD medicine for at least the basic concepts. So visual memory is actually makes a difference, because at the end of the day, when like something is asked, good visual memory helps you to just recreate that in front of your eyes and you are able to tell, because otherwise the books are too vast, you cannot consolidate, it becomes extremely difficult. And other way around is the Google images. So Vijay knows like how I was preparing for my DM exit exam. I had almost around 450 Google images, which would take initially for me at least 2 3 hours to kind of go through. And towards the end of the 1 month of your exam time, within basically 5 10 minutes, I would finish all those 450 images because I knew this is how it is. So it makes a very
Right.
big impact that you have a visual picturization of some particular concept and some idea, even a flow chart or anything of that sort, and create something very simple. So good. Thanks for letting us know that at Doctor we kind of do that and help you out. But why medical oncology? You know that there are all those fields. Students do think up of cardiology, neurology, nephrology as all the best field. But why medical oncology?
Sir, I mean, frankly, I was actually looking for a branch wherein I would not be restricted to a particular specialty. I mean, I was telling the other day someone that whenever I was posted through any specialty, my friends used to tell me that you're not loyal to a particular branch, whichever field you go to, you're like, I want to take up this thing. And my seniors used to mock me for that. And you won't believe, but I had almost started to prepare for neurology. I was halfway through preparation for neurology. And during my final year, I had these rotations for oncology that we have for a month or two at our college. So I went through oncology rotation and I found that sorry, neurology. I think oncology will be the branch, and I mean that's how I mean revamped my preparation. I mean
Right.
probably it was a bit late to start because I was preparing for another specialty, but I don't think it matters in the long run.
Right.
So I mean I realized that one day I was seeing head and neck oncology, and the next day I was posted in gynae onc clinic, and the next day I was posted in hemonc. So that variety is something which I liked in oncology, and the fun for the reason why I took up medicine was for the fun of diversity that there is. And I did not like the idea of myself being restricted to a particular branch. I mean, not bad mouthing any specialty, but
Yeah.
I don't want to be restricted to a particular branch and doing that only, or being a very tunnel vision for that. So
Organization.
oncology provided me that. Also, I love teaching. I like doing research, and this is the branch wherein I can be as close to academia as possible. So
Absolutely.
that's why I took oncology.
Absolutely right. So basically, say like if like today's clinic, I was telling before the interview that how long it ran. So I had just one patient yesterday who had CA esophagus presented with breathlessness rapidly. Usually, probably you'll think or say he's developed a tracheostomy fistula, but then he had these basic capitations, elevated JVP. You know that this patient is in cardiac failure. Picked up an MI. Okay, so you need to kind of have that medicine knowledge to keep going. Another patient with cholangiocarcinoma, whom I know the markers are coming down, clinical responding, but is developing ascites. She basically has developed portal hypertension. So these are things that you end up picking up every day. It is not only a different branch that you'll see, but also there's so much lot medicine into it that people probably don't realize. They end up thinking that it's a depressing subject, but only once you enter it, you know that how lively it is, and you start respecting life much more. Yeah, most of the oncologists are happy people. You never see a grumpy oncologist as such. So they are happy people because we kind of respect life, we admire life, and we know that how things are important in life, right?
And
So
this is the branch where you give dignified death.
yeah,
Even the end of life care is so important.
the mortality is
People
respected.
thank you for having taken care of those patients well towards the end of life.
Right. And when I was posted through oncology in my final year, frankly, I had not been through a specialty wherein the patient would come after 10 years of surviving and literally bow down to the consultant and touch their feet and be like, thank you, doctor, for saving my life. I mean, all specialties do that definitely.
Right,
But the kind of gratitude that one has and the kind of stigma that is attached to cancer and survivorship, that thing really changed my perception of oncology. I'm like, patients do survive.
right.
They survive for very long.
Uh,
They come back with very good awe and respect for you, and that really inspired me.
yeah.
So
And this is
Today,
one of the branches wherein there is a constant change and an updation which is happening right every minute and a
yes,
day.
yes, that is true, sir.
today I just had 16-year-old Hodgkin lymphoma who survived now. She's now 2.5 years into her remission, and she's kind of telling that she's now into 12th, and she's telling that I want to take up medical oncology as a part in future. So that kind of makes a huge impact. That at the end of the day, there's so many things that go bad, but these are the small things that you end up cherishing and doing it. Fantastic. So, being from background of AIMS and kind of really realizing that medical oncology is a field. Now, how do you think has is like should one prepare for INISS?
Sir, I think INISS, I mean, gone are the days when, you only have to focus on the specialty of interest. I feel medicine, the 30 marks that are there for medicine, they are the rank breakers or the rank makers. So, I mean, you can't really be aiming to score very well in this exam if you're not thorough with medicine. So perhaps I would say you should not be loyal to any branch till final year. I mean, you should read all the specialities that there are wherever you are posted. I mean, very truthfully, or whatever basics you can cover in that particular specialty, so that at least by the end of that rotation, by the end of that month, you are at least aware of what all topics there are, what are the basic things, what are the hot topics, what are the things that you need to revise before the exam. So they're not going to ask in the exam very factual things. They're going to ask things which you practice on a daily, day-to-day basis. So, like, they will ask toxicology, they will ask heavy metals, they will ask things like occupational lung diseases, which probably you would not read very well during your MD medicine. And even if you read, you would do that just before your final professional exams and end up forgetting it before the final, maybe the entrance exam. So, I think these are the key to focus areas. So, if you are confused as to what should I read for general medicine, just close your eyes and think what are the topics that I actually encountered in my medicine or during that specialty rotation, and just go through them very quickly. To add to it, add a couple bit of infectious diseases, the drug of choices for the various infections, the investigation of choice for those infections. For instance, the fancy infections like brucellosis or bartonellosis. These are the things that AIMS usually likes to ask. Also, there's a dedicated infectious disease department here, so they will definitely ask these things. Also, things like myocardial infarction, stroke, the basic emergencies that there are, common seasonal infections like dengue, malaria. These are the common things that you have to focus, or maybe go through rapidly before the exam for medicine. For oncology per se, I would say you don't need to go into very depths of oncology. You can divide it into general, hematology, and solid oncology. General, you need to be thoroughly aware. Just go through the first 750, 800 odd pages of Devita thoroughly, uh, the old Devitas, not the new one, and try to go through all the topics that there are, and try to consolidate it in your mind. Also, you should not forget the importance of things like next generation sequencing or polymerase chain reaction, not just the types, but also how to interpret an NGS report. There was a question on how will you interpret this NGS report a few years back.
Right.
So they will ask very practical things like that. I mean, compare HLA matches? How do you plan a patient for BMT? What are the drugs that are given before BMT? What are the complications that can happen? Febrile neutropenia, oncologic emergencies among the general part, and also very importantly, all the drugs and thoroughly, their side effects and everything. Amongst hematology, you need to be thorough with all the major hematological malignancies, all the lymphomas and leukemias, the common ones. And among solid, just make a list of the common malignancies in India, and you should be aware of the epidemiology of each of them thoroughly. The top five cancers in Delhi, the top five cancers among male and females in India, the top five cancers amongst males and females, as well as the mortality causing cancers in the world, things like these, and also very basics about the management and the drugs that are used in the management of the same. So you may not remember the exact indication of bevacizumab in CA ovary, but you should be aware bevacizumab is used in CA ovary, and you should be aware when should you not use it, and what are the complications expected out of bevacizumab. So I think that's how you should plan out your study.
Yeah, aptly said. Oncology is more of medicinal aspect. The per se in-depth oncology is never asked. Basically, you need to know if in case you're going to use a drug, what happens before that, what can happen after that, and where probably you'd use it, where probably you'd not use it. So most of the time they end up sticking to the basic, and epidemiology is one topic which you told absolutely right. Multiple times, all of us students have also asked, and that's the same thing we keep on repeating again and again, that this is the list of the most common cancers in the world in India and how probably that would make a difference. So that was about INISS theory. The theory part, medicine is equally important. You cannot neglect the medicine, but probably yes, focusing on oncology. Oncology probably working and probably having some certain oncology background makes it much simpler. because this is one subject which I feel it is very difficult to read from the books and remember and understand in case you have not got exposed to. Luckily, more and more MD programs are now getting exposed to medical oncology, which was not so before. So it happens to be important that you have some exposure, at least some work experience before you either take up medical oncology or at least to answer well in the in the DM medical oncology exams. Now, once you cleared the theory, we did end up doing some mock interview sessions. How did that help, and how was the actual interview session also?
Sir, I really feel that although interview is important, but ultimately what will decide your selection will be your theory marks. So, there is no doubt about it. There have been several instances wherein, people have scored really bad in theory and even interview could not save them. So, I think focusing on theory A, but when you talk about interview, I feel that what the examiner tries to assess or the faculty over there try to assess is your basic personality, how you talk, how, obviously they'll not be able to assess how you walk because it's on virtual mode, but how you're behaving, how you're talking, how respectful you are, what kind of research you have done, because ultimately it's a central institute, and whether you are thorough with the research that you have done, what thesis did you do, and what were the research principles involved in your thesis. So if you utter, say, your thesis was on interstitial lung disease, they will not blink an eye and ask about interstitial lung disease and maybe ask what are the drugs used in oncology that will cause interstitial lung disease. So, things, they will draw the interview from what you speak. So if you say my thesis was on obstructive sleep apnea and obesity, they will ask what are the cancers associated with obesity, name 10 of them. So,
Right.
try to expect and anticipate what the examiner will try to ask with each and every word that you will utter. They will draw a question out of that. Also, you should be very thorough with the epidemiology aspect. As I told you, it will be a sure shot question in interview, and it was asked to everyone. The other day I was discussing with Dr. Hemant also as to what they asked in epidemiology, and so I was like, did they really ask this? And I said, yes, I mean, they really asked this.
Yeah.
So if you say that I'm from Maharashtra, they will definitely ask that what are the top 5 cancers in Maharashtra. So you should be very thorough with the National Cancer Registry program. Go through that document, the PDF. You should be aware about the epidemiology of the cancers in your particular area. If you say you're from Northeast, they will definitely ask what are the cancers common in Northeast and why is gallbladder common over there and what are the risk factors from gallbladder cancer. If you utter female over there, and then they will ask what are the cancers associated with female sex and tell me something about estrogen, then they'll ask about tamoxifen, and that's how the Viva will roll on.
It just goes on.
So you should anticipate these things.
Yeah.
And the interview session that we had in doc tutorials, it was really nice. It was very comprehensive. Frankly, I had fun, attending that. And they were trying to grill and try to mold you as to you should change your answer, but it was fun doing that.
Yeah. Yeah, absolutely true. It is more about the basics, more about your personality, the way you answer, how confident probably you are, probably in dealing in day-to-day things as well. So that is where it is. And Shubham, what are your interests?
Right. So, nice question. So, I was having this discussion with Sir before that as well. So, I mean, my interests per se, I mean, right now would be academia and research. And I mean, I have other interests as well. I like playing badminton, but as it is in medicine that you have to sacrifice on your interests a lot many times. And I like writing poems as well. So you can say I'm a poet.
Fantastic.
So
Yeah.
and I like vibing to music and listening to music. And you know I don't think there has been any college festival that I have missed since UG. Even just before my final exams, there was Pulse at Ames, and I really attended that. So I like
Yeah.
attending things like these and social events. So and also surfing YouTube and Instagram.
That
Fantastic.
keeps you live, basically.
So,
Yeah.
for the viewers, this was the same question that was asked to Shubham, and he answered only the first line, that is academy and research. The rest, everything he's telling us here. Fantastic, Shubham. Vijay?
Yeah, very good, Shubham. That's it from my end.
Yeah. So you actually gave them a, comprehensive idea on how to prepare, because it is extremely important. Somebody who's got rank one to guide others. because in case it's easy to always look upon to somebody else who has done it, and it becomes an easy path to kind of repeat the same thing rather than go through a newer path. And fantastic, Shubham, welcome to medical oncology. It's a awesome field, and we are more than happy to have you in this field. And more so, we are going to be meet and soon as colleagues, and probably someday I would kind of definitely come down to Delhi and meet you. And
Thank
of course, conference later on, and probably join together in some academia work where we end up teaching more students and trying to guide them better. Thank you, Shubham. All the best for the future. Uh, Vijay, any concluding remarks?
That is it from my end.
Okay, fine. Thank you, guys, for watching. This was a short and crisp interview with Dr. Shubham, and that's it from the faculty of Dr. Tutorials Medical Oncology. Thank you.
thank you, sir. Have a great evening.
Thank you.
Thank you.